Hey guys, it's Casey and welcome back to my channel. And today, I'm wearing scrubs. I never wear scrubs. I am a certified scrub hater. But today I am wearing scrubs and a slick back because today I was a teacher of medicine. I mean, don't get me wrong, I am a teacher of medicine every single day of my life because my hospital is fully reliant upon the labor of interns and student doctors and registers, much more so than pretty much any other hospital that I would care to name. But today I was a teacher of medicine in a different capacity. I was a virtual teacher of medicine. I gave a seminar, a 3.5-hour long seminar to one of the top medical schools in the entire world. And apparently they don't take you seriously in the modern West, student doctors, unless you were wearing scrubs. And so today, not only did I put on scrubs, I also successfully ripped up a pair of scrubs. Specifically this pair of scrubs, which is fine. This is just vending machine scrubs. Specifically, this is Ashton's vending machine scrubs because he's the only one who wears them. And they were much better than mine. He's like more black than mine. I don't know why. But I had to rip them up as an example of how to take care of a patient because apparently even that is too much of a hassle for modern day doctors to comprehend. I was in the middle of teaching. I'm like, well, if you have a patient come in and you don't have scissors, what do you do? And they were stumped. They had no idea what you did in those circumstances. I'm like, well, you rip the clothes off. Like you rip it with your hands. I'm like, well, you can't rip clothes with your hands. So I had to go get dirty scrubs and show them that yes, you can very much rip material with your bare hands. You don't require scissors to cut them off in an emergency. You can just rip it down the middle. And they were stunned, which I feel is like the perfect analogy for exactly how incompetent modern Western medical training is these days. Like, you don't actually learn how to be a doctor, you just learn how to do one thing very, very well. And God help you, God help your patients if they ever require anything outside of that one skill that you spent 12 years mastering. I don't know what it is about modern doctors and their complete inability to rip things. It's basically their kryptonite because I have encountered this problem before in the 11 years that I have been in the modern West. I haven't been working as a doctor for the 11 years that I've been in the modern West, only for the past 7 years. So in the past 7 years that I've been here, this is not the first time that I have encountered doctors who have had this very specific problem. I've told this story before on my channel that I once had a fellow come to my hospital on a fellowship because my hospital is part of ACRM, which is the Australian College of Rural and Remote Medicine. So fully trained doctors come here to learn specific skills that they can't learn in their own hospitals. I had a fully qualified surgeon come in and a patient came in needing wound care and we had run out of ribbon gauze and she just stood there like she was a deer in the headlights. She had no idea what she was supposed to do in this circumstance. I'm like, well, go grab some regular gauze and cut them up. They're the exact same thing. Ribbon gauze are just regular gauze that have been cut into strips. I had to explain it to her like that because she didn't get it the first time that I said it, I actually spelled it out to her exactly what ribbon gauze were. And then she was like, oh my God, I wasn't aware of that. You are a fully qualified doctor. How were you not aware of that? But I had the exact same problem today, over and over and over again. Again, I did a 3.5-hour long seminar for what is supposed to be a top 10 medical school in the entire world. And they just didn't get it. They had no clinical skills that I would be comfortable putting into practice, which fair enough, they are medical students. I think that they were like, to be fair, first year medical students. But a lot of this is just basic common sense. You should be able to use your brain, even if you don't have a medical degree, to be able to piece these things together. And they couldn't do it. And just for full transparency's sake, I am a trauma specialist. I am a remote medicine generalist, as well as the clinical lead at our hospital, which sounds a lot more impressive than it actually is if you consider the fact that our entire hospital is made up of me, one other doctor who is 2 years post-registration, 2 nurse pracs, an ever-revolving door of international nurses with very questionable qualifications, a social worker who doubles as our triage, and a security guard who doubles as our cleaner. So it is a very small and condensed team, but it is a very high working team, a very highly skilled team, because you have to be to work in the environment that we work in. We primarily service a Australian Aboriginal majority community on the edge of the Australian outback. So if you don't know anything about Australian Aboriginals and their health outcomes, let's just say that they are very, very poor, especially compared to literally anybody else. They are probably one of the most underprivileged demographics in the entire world in terms of physical health outcomes. Their life expectancy, even in our shitty little town at the edge of the Australian outback, is 9 years less than any other race within our town. That's how bad it is. There are a lot of social issues from birth that lead into a lot of physical health issues across their lifespan. So anything that you can think of, times it by 10, and you've got the Australian Aboriginal community. So it's very, very poor. It's very, very sad, and it's also quite poor and sad that it's just me and Ashton kind of dealing with them for 300 kilometers in one direction and 1,200 kilometers past state borders in the opposite direction, because we are the nearest hospital, the nearest medical facility with an emergency room in either of those two directions. That is not the point of this video. The point of this video is me once again making the claim that medical schools in the modern West are a scam. I have literally made a video titled "Medical school is a scam" before. I think it was like a year ago, but I stand by that statement. And today, well, I'm not going to say that it cemented the statement, because the statement was already well and truly cemented in my mind, but it just confirmed that I had the right mindset when it came to making that statement, that medical schools in the modern West are not good. They do not teach medicine. They teach one skill very, very well. And if you don't have that one skill, then you're pretty much useless. What am I going to do with you? I'm not going to do anything with you, because you can't change a bandage. You can't... It's not even that you can't change a bandage. It's that you can't even set up in order to do that one skill by yourself. You can't sterilize your own field. You can't set up your own tool tray. You need someone else to do it because you've never been taught how to. And I think that's just pathetic and really, really sad. I was trained as a doctor under the traditional apprenticeship model, which I think, well, I don't even think, I think objectively it is far superior of a model, especially in terms of just age. I was a fully qualified specialist by the age of 26. I had finished my medical studies. I had done 12 years of medical studies, and I had over 20,000 hours of direct clinical practice. Compare that to the Flexnerian model, which is the supposed training model that modern Western medical schools use. But again, I don't think that they actually do, because in the Flexnerian model, you were supposed to be finished your training in 2 to 4 years, depending on how well you engage with what you're learning. But Lord knows that you don't finish your training in 2 to 4 years. They stretch it on to stretch every single cent that you are willing to pay to chase this dream for as long as humanly possible. So by the time that you are 25 or 26, on average, you are 2 years into medical school. You have a very, very long way to go before you ever even see a dollar that you're earning, because that is the difference between the Flexnerian model and the traditional apprenticeship model that I came up under, is that we started training at 14 to 15, because standardized education ended at 14. So in the 8th grade, you finished your standardized education, then you would go into your specialization education. So if you're going to train medicine, you would go and you would train medicine. From day one, you were getting paid. You're not getting paid a lot. You're not getting paid huge dollars when you were 14, but you were getting paid enough to pay for your food and your board and something a little bit fun every fortnight. But no, in medical school, you were not getting paid. You were paying for the privilege of being yelled at by egomaniacs. I'm an egomaniac. I'm aware of that. And I do yell at students. But that's because they're stupid. And the reason that they're so stupid is not their fault. It's by design of the medical schools themselves, because they have inverted the training model. The problem with the Flexnerian model is that you don't start in the clinic, you start in the classroom, you start with lectures, you start with seminars, you start with tutorials, you start with anatomy, you start with theory, and then you are tested on it all. But you don't actually know what you need to know yet. You have to memorize this enormous amount of information, and nobody tells you what is actually going to be relevant to your career as a doctor and what is just blatantly theory. It's all presented as equally important, and it's not equally important. Your head is going to be pumped filled with unbelievable amounts, unsustainable amounts of information, 95% of which is completely irrelevant to your actual career as a doctor. However, because you have no clinical experience, you have no practical skills, you are incapable of distinguishing what that 5% of information that you were being taught that you were going to require in your day-to-day practice actually is. And they're not going to help you with that. They're not going to help you distinguish that knowing the symptoms of Ebola is a lot less necessary than understanding and recognizing the symptoms of bacterial meningitis. They're going to tell you that it's equally important across the board because you need to pass a test for it in order for them to keep their numbers up. And so the system as it stands currently rewards students who are incredibly good at memorizing information but may not make the best doctors in a clinical sense, and it penalizes students who are not so great at memorizing but could be the second coming of Florence Nightingale. However, as someone who is a clinical lead of a hospital that is fully reliant on student labour, I also think that this is actually by design by the medical schools, because it keeps students in a debt spiral. It keeps them in a sunken cost fallacy. If they were to push clinical skills to the front and have them done by day one, a lot of students would drop out. They would drop out. It's something that I have observed over the past 7 years that I've been in charge of my hospital as someone who takes on a lot of students, that a lot of the students that I get are not suited to medicine. And a lot of them don't enjoy medicine, but they are so far into the course that there's really no exit strategy for them. They have to keep going because they have so much debt. They have put so much time and effort and energy. They have put so much of their identity into this that they can't just back out, even knowing they know full-heartedly that this is not the correct path for them. Had they had clinical training from day one, they would have distinguished very, very early that this is not for them. But by the time that they actually get to clinical rounds, it's too late for them to quit. If a medical school has 25% of their students dropping out in the first year, that looks really, really bad for them. And so they don't want to do that. They want to keep students in that cycle where they have no option but to keep going forward. Whereas the system that I was trained under, the traditional apprentice model, was the inverse of that, and that you spent the first 10 years of your medical training, keeping in mind that you started training when you were 14, 15 years old, with a mentor. Well, for the most part, you did. I did because my mother was a physician and so that I was her apprentice. But if you weren't able to match yourself with a mentor, then you would spend a year in medical school. And then if they thought that you would make a good doctor, they would then match you with a mentor. But for the most part, you spent 10 years, the first 10 years of your training with your mentor, learning from them directly, learning from the older students that they had taken on directly. Anyone else who was working in their home clinic, you would learn from them directly. And then only at the end of your medical training, the last 2 years, would you go into medical school and have your skills tested before you could be fully licensed in order to work on your own. The purpose of medical school was that you brought all your experience over the past 10 years under your mentor to the table, and they tested them all. They tested everything that you did in order to ensure that you were competent to practice. And if there was any gaps in your training, they would fill them in so that everybody was working from the same standardized level of care, no matter where you were living, because all physicians had to go through the same training. They all had to excel in the same tests. I actually have the list of procedures that we had to show that we were competent in because I was reading it out in my seminar today, and I'll read it out to you as well. Keep in mind when I'm going through this that you had to be competent at 80% of this in order to graduate. General medicine, specifically lumbar puncture and pleural tap. Dermatology. Ophthalmology, specifically enucleation of the eye. Ear, nose and throat, psychiatry and mental health counseling. Urology and STIs, specifically catheters and suprapubic cystotomy. Thoracic, specifically underwater seal drains. Burns, specifically split skin grafts. General anesthesia, local and regional anesthesia, specifically spinal and Beer's block. Surgery, appendicectomy, specifically the following procedures: craniotomy, laparotomy with exploration of the abdomen, oversewing perforated peptic ulcer, splenectomy, management of other abdominal trauma, colostomy, tracheostomy, phagoscopy, bronchoscopy, sigmoidoscopy, plastic surgery, hand injuries, amputations, management of tendon and nerve injuries, orthopedics, specifically conservative management of all types of fractures, including skeletal traction, management of cervical and thoracolumbar spinal injuries, treatment of dislocations of minor and major joints, and management of lower back problems. Obstetrics and gynecology, specifically dilation and curettage and ectopic pregnancy. Dentistry, and this is one of the very big ones in which no one at medical school does these days, but dentistry, extractions and conservative treatment, laboratory methods, urine, blood, microbiology, biochemistry and cross-matching, pathology, limited post-mortem, physical therapy and physical rehabilitation, nursing, sterilization of equipment, drug and equipment inventory, nutrition and diuretics, first aid instruction. And then, depending on where you lived, these were location specific, but you also had diving medicine, aviation and retrieval medicine, and altitude medicine. Well, that was a challenge to my poor English skills, which are not great on a good day, but that is what we were expected to be able to do. At least 80% of it, you had to be able to successfully pass 80% of those procedures to a competent level in order to graduate as a medical doctor and get your full license when I was at medical school. Compare that to modern Western medical school, in which most doctors only ever learn one of those skills. But that's my main gripe with modern Western doctors, is that you just don't know how to do anything. You know how to do one thing and you know how to do it very well, but God forbid something else comes up during that procedure. It all needs to grind to a halt while you go find someone else who can do that one thing very, very well. It's a never-ending cycle. It's just, like I said earlier, it's pathetic. There is no other word for it. It is a pathetic, pathetic system. I always think about my mother, and my mother was a fantastic physician. She was very well known in her field. She'd won a lot of prizes. She'd been the head of a lot of research projects. She'd written a lot of papers. She trained a lot of different doctors. She was the head of medicine at our university, which in and of itself, the local university in the city where I grew up, which in and of itself was a world-renowned university for medical training. And she was the head of medicine there. So she taught the students in the last 2 years of their medical training. So she taught a lot of different students. Everywhere that I went, people would come up to me and tell me about how they learned under my mother, and they either loved her or hated her because she was a right butch. She was horrible in a lot of ways in that regard as a teacher. But she was very, very knowledgeable about what she did. Now, when I was a teenager, I went to war on 2 separate occasions, only one with my mother. So the first war that I went to, my mother got recruited at the end of the war to be the head physician at the base camp of one of the sides of the war. So we went and she did all that. And I always remember right at the end, like in the last couple of weeks, she had gone off somewhere. I don't even remember where she had gone off, but I was alone in like the ICU area, and some kids, I say, they were soldiers, and they'd been playing around with explosives, and explosives did what explosives does, and one of their legs had been blown off, and the medics brought him in to the ICU unit, and my mother wasn't there, and so I was having to deal with it by myself as best that I could, and so I managed to, keep him where he was supposed to be and get everything so he wouldn't bleed to death before my mother come back. So she comes back, she takes over, and then at the end, she is the one who got down on the floor and cleaned up all the blood, because there was blood all over the place. And I always think of that whenever I see modern medical students, because they wouldn't know how to do that. They wouldn't know how to sustainably and successfully clean up a biohazardous spill, because they don't have those skills. They don't have that knowledge. All they know how to do is just the one thing that they know how to do. They don't know how to drape. They don't know how to bandage. They don't know how to do anything other than that one skill that they're specialized in. And I think it's horrible. Anyway, I have got a lot more to say on this topic, but that's it for tonight because it's 10 o'clock at night and I have to go back to work in an hour. I went to work today because I work 6 days a week. I work 5 days a week on the floor, and then I work 1 day a week as the clinical lead. So I deal with everything that needs dealing with, and today was my clinical lead day. However, I am going to be covering the night shift as well, so I need to go and I think I'm going to wear these scrubs actually. Why not? I'm already in them. So I'm going to go to work. But before that, I need to get ready for work. So I'm going to go do that. And alas, huzzah, this is Casey signing off for the night. As always, stay weird out there, stay safe, and have a productive evening. Good night.